A warm hello and welcome to another episode of the series Sleep Lab with Netzer and Popovic. In today's episode, we want to introduce you to a very interesting and highly topical revolution in the field of sleep medicine. Over time, researchers and sleep physicians have wondered whether the effort involved in a huge sleep lab couldn't be achieved with simpler means. And over time, developments have emerged that allow for a miniature sleep lab. And one of these marvels is a small ring. It looks like a wedding ring. You wear it on your finger. And this ring is able to capture many of the parameters we need in sleep medicine to interpret diseases or healthy conditions, and then to interpret that data with the help of artificial intelligence.
Yes, what used to, in principle, you have to say, take up entire rooms. You mentioned your Graz era. Back then, a sleep lab was as big as an entire room. We know that from old computers, of course. Yes, today you can fit that on your wrist. You know, I'm a fan, I have to say, of classic watches. I'm not wearing my smartwatch right now, but I did get one as a gift from my wife. And if we take the ring, then the term trap for such an alternative wedding ring, which my wife also wanted to give me, yes, be careful, takes on a completely different meaning. Well, what do you think, Rainer?
That's absolutely right. And I'm reminded of an anecdote where a man's infidelity was, so to speak, uncovered by an unexplainably high heart rate during the night. That then led to the divorce lawyer getting involved, and they were able to prove with this sleep study that a nocturnal, otherwise unexplainable increase in heart rate was the cause of this affair.
Yes, well, of course, we don't want to discourage people from buying a ring. But please, with all of these devices, not just the ring, but smartwatches and so on, be sure to also consider data privacy to ensure your data stays with you, because it's really astonishing what you can do with these small devices today. Now, everyone might think this has something to do with magic, and it's not magic, but there are a few tricks of modern computer technology that are being used. So today I've brought along a very simple pulse oximeter. In the past, right, Rainer, you remember these cost a few hundred to over €1,000. Nowadays, you have to say,
on Amazon for €50, €30.
Yes, no stealth advertising here, but in major German drugstores, there you go, they're available for just a few euros. And I'd like to use this pulse oximeter here to explain how the whole thing works. So I'll just put it on my finger here, yes? And then it will immediately show us the values. And what do you think?
Well, I'm fascinated. If I may explain briefly, on the pulse oximeter, we see a number on the left, which is now at 95. That's the oxygen saturation, which is a relatively good value. And next to it on the right, 66 is the heart rate measured at rest, which is absolutely normal. But what we also see on the far right is a flashing bar, so to speak, that represents the heartbeat. And below the numbers, we also see a waveform that basically shows us the pulse wave.
Yes, and now let's focus for a moment on this curve down here. So as I said, on the pulse wave curve. And you can see that whenever a pulse comes, there's a small peak, so to speak. And Rainer, to us, if we look at it again, I think it looks as if the intervals are always the same. In reality, however, the intervals are different depending on how high our adrenaline level is in the body. So there are small millisecond differences between these peaks. And these millisecond differences are now being used to, so to speak, suddenly create a sleep profile from them. Of course, it's a trick, no question about it. And it's not entirely comparable, but it is quite amazing. We've seen in other episodes how many signals we need in the sleep lab to measure something like this. And now, from this single curve, we can more or less try to create a sleep profile and measure sleep quality. That's what the smartwatches and the rings, or whatever they may be, do. And but we'll now have this explained in more detail in an interview by Germany's most famous expert on this technology. Hello, Professor Malberg. You are not only an engineer for biotechnology and medical technology, but also a certified sleep specialist through the European Sleep Research Society. You've also organized the German Congress for Sleep Medicine, and that's why we've known each other for many years. And I think that's why we'll stick to, I would say, using first names. Hagen, for me, the first and most important question, of course, is about the wearables, especially the smartwatches. What's your take on that? Can they completely replace us as sleep physicians, either now or in a few years?
Well, completely replace is always a very difficult term, yes, because the diagnosis is always made by a doctor, the one who also bears the responsibility. It's a matter of what technology they use to arrive at their decision or diagnosis. And at the moment, I would say that's still difficult. It has to be said, we are expecting further technical advancements, testing and approval for such wearables or smartwatches to be authorized for clinical diagnostics. It's in its early stages, so to speak. But I think for some issues, especially clinical issues, and one of the main issues is sleep apnea, meaning the lack of oxygen during sleep, such simple wearable at-home devices can achieve very significant progress, meaning that you don't necessarily have to undergo a major complex diagnosis in a sleep lab. Yes, so the patients don't have to come to the hospital and stay for 1 or 2 nights. This is already being done in part with at-home technology, and I think this trend will continue. But that certainly doesn't mean at all that all conditions, all those that can potentially occur during sleep, can be diagnosed with simple, let's say, body-worn diagnostic devices. I think there will perhaps be a bit of a concentration or specialization. So especially neurological cases, things like movement disorders or whatever else can happen during sleep, they will more likely end up in the sleep lab. That will probably also reduce some of the demand on sleep labs. And other things that need to be clarified first could, in my view, be handled at home and could thereby also somewhat improve, let's say, sleep medical treatment overall. So overall, I see this as a positive trend. However, at this point in time, I'd like to say that regarding what many smartwatches and wearables and similar additional devices promise, I would be a little skeptical to say that yes, based on the information that such a device provides in the home environment, you can already make a diagnostic decision and above all, initiate a therapy. I would be cautious about that for now, but in my opinion, the trend is underway. What is positive, what is already positive now, is that many people are engaging with their sleep. Yes, so people look at it and say, aha, somehow there's deep sleep, there's light sleep, there are sleep interruptions. Before we could measure anything on the body at home, this wasn't really that well known among the general population. And it's already a positive development that people are engaging with sleep at all. And that in itself is a positive thing. As for whether we can really make full medical use of it, I'd be a little cautious about that at the moment, but I think the trend is moving forward.
Hagen, politicians are really pushing hard for telemedicine. I imagine they're also hoping for cost savings in the healthcare system. So basically a doctor's visit without actually going to the doctor's office. How do you see this in relation to wearables? Is telemedicine one of the main fields for these so-called doctors on the wrist?
Yes, well, as I've said, I find the term doctor on the wrist to be very, very problematic. You know, a treatment isn't just about measuring a value and then saying, okay, based on this value, we'll decide to do this or that. In principle, I see it as a positive thing. I think telemedicine is a very important development that we're currently experiencing. I'd like to go back a little in history. Yes, so it was, yes, almost a little over 100 years, maybe 130 years ago, that it became possible for the very first time to measure biosignals, the ECG, you know. It even won a Nobel Prize. A little before that, the X-ray procedure was developed, yes, the ability to see inside the body. And that was a genuine revolution at the time, being able to use physical means, that is technical means, to gain information about the condition and the structure of the body. And from that, what's known as apparatus-based medicine developed, which then became concentrated in hospitals and doctors' offices with specialized personnel who could operate these complicated devices. And of course, the effect was that the general health and suffering of the population decreased thanks to this technical development. And now we have, let's say, a similarly exciting situation because the location of medical treatment itself is currently changing. It's moving out of the clinic and the doctor's office and into the home environment, right? This means the place where devices are operated, and they're getting simpler and simpler. To measure an ECG, we don't need a doctor anymore. Even a watch can do that nowadays. Something is really changing there. And for the first time, we're in a position where someone who isn't specially trained, so not a doctor or someone in a healing or nursing profession, can obtain signals and information about their own body themselves. And that is, of course, a completely new situation, but I also see a great challenge in it, because there are an extreme number of many very simple routine examinations that have to be performed in a doctor's office or in a clinic. And you have to say these forms of diagnosis are used, they are highly relevant, and you can only apply them if the patient, until now, comes to the practice and to the clinic. If we could manage to have patients do this at home under standardized conditions without major additional effort, then I believe that's a positive development, that a doctor can obtain such information during the routine normal life of the patient. But now, of course, you have to say there are also a few particular difficulties. Right now, telemedicine is, I believe, one of the major driving forces in medical development. That is the shift of treatment into the home environment. But at the moment, the first problem is that many aspects of this technology haven't been fully resolved. So you also have to be very clear. Politicians in particular often trust claims from the industry where you have to be somewhat cautious about whether it's more of a promise or if it's reality, how well such technologies actually work. Because we simply have to say, when something is put on or used at home, there's no medically trained personnel there to check that it's all being done correctly. So that means telemedicine, especially with wearables, is much more prone to error than if it were done by trained personnel in a clinic or a practice. That's the risk we have. And that's why I think the trend, especially for chronic diseases, where a lot can be done for risk prevention, for catching a sudden deterioration in health, the ability to use these devices at home in your free time, I think that is a positive trend. But there is a lot to do. Yes, the first thing would be you have to make these systems secure, you have to validate them. You have to somehow deal with the amounts of data which didn't even exist before. And then we also have to be very clear. So far, politicians are essentially saying, you doctors, you have to do this in your free time, right? To that, I have to say, no, that's there have to be structural changes. There also has to be an adaptation to this new form of treatment. So there are technical developments, there are organizational developments. There also have to be economic changes. And in that respect, I believe it's a positive development. But to say we'll just use this one-to-one like this and can apply it immediately, and it will solve our problems, especially a shortage of nursing staff or similar things, I don't see it that way. So overall, the technical development is positive, especially for chronic diseases. I see that very positively. But it has to be embedded in a complete treatment concept. And as long as that doesn't happen, I see major difficulties for it to become established.
Yes, I think we've already discussed this privately, and I think we're of one mind on this. And perhaps now, through this interview with you, it's a good explanation for patients who might be disappointed because their doctor says, no, I'm not quite on board with that yet. Another question. The world is talking about AI, and this goes a bit in the same direction as the previous question. Here too, politicians seem to think this will all happen in a flash. How do you see this regarding, as I said, smartwatches, wearables? How do you see the use of AI there? Does it bring another leap forward, or is it actually the case that with the current signals, we just have to learn to deal with what we have?
Well, I would put forward the thesis that without AI, smartwatches and telemedicine simply aren't possible. Yes, I have to say, They really go hand in hand. And perhaps as an engineer, I need to elaborate a bit on what we mean by AI. It's always presented as a panacea or a magic bullet that can do everything, explain everything, and that we won't need doctors anymore. And a lot is always explained in that direction. I don't quite see it that way because we develop these AI systems ourselves, and because of that, you naturally know exactly what they can and cannot do. So to be a bit educational, now I'd say artificial intelligence, these systems aren't that, even though the industry likes to promise that they are intelligent. You know, a light switch that turns on when it gets dark isn't intelligent in my view, right? It's just a physical effect. It gets dark, a circuit closes because a resistor's value changes, and then the light comes on. There's nothing intelligent about that. So what is intelligence to me? It's actually the ability of foresight. That is, for me, intelligence means I can imagine something, I can run thought experiments, I can imagine that if I do this, that will happen. If I do that, this other thing will happen. And depending on how well my predictions come true, I am more or less intelligent. That's my definition of intelligence. And these machines can't do that. So these are really just algorithms. And at our institute, we actually use the term machine learning, as do many engineers. We call it machine learning. And these are essentially classification procedures. So classification procedures, they have data, large quantities of data, masses of data, and they're supposed to find something within these masses of data. And they can do that more or less well. And there are really two main approaches to how you can do this. The first approach is what you could call a kind of similarity-based procedure. Yes, you feed these classification algorithms a lot of data and says, this is characteristic of class A and that is characteristic of class B, and you just memorize that. And if you get an unknown data set, you can decide for yourself whether it's class A or class B. So that's basically, those are similarity-based measures. And then there's another approach where you say you don't predefine any classes at all. You say it's just a huge mass of data. And I suspect that within this large mass of data, there's a class A and a class B. And I tell the algorithm, you now work until you can somehow separate two groups from this large mass. How you separate them, I don't care, as long as they are far apart from each other. And you do this until I'm satisfied. I mean, I can have it run for days. And in my opinion, that has absolutely nothing to do with intelligence. Yes, so that means these are classification algorithms that work excellently. That's very important. And we also use them everywhere in modern signal processing. So, and now let's get back to telemedicine. Yes, so what does telemedicine mean now? I have a large amount of data from the home environment, which is in a way unreliable because it's not recorded by medical staff, but by the person themselves under whatever conditions. So they are also, with a high probability, more prone to errors than data that comes from the clinic under all sorts of conditions. So, and you have day-night cycles, all sorts of things. I mean, from user errors to all kinds of other influences, they're all in the data. And secondly, it's a lot of data that a doctor simply didn't have before. Yes, so if they suddenly get 2 blood pressure readings or sleep values from the patient twice a day, they never had that before. And now I simply have to say, if I want to introduce telemedicine meaningfully, then just as I send a sensor home with the patient, I must also provide the system with the data processing to extract or classify meaningful information from that data. To the same extent, and in my opinion, that has been rather forgotten recently. Yes, so measuring devices were sent home, a lot of data was collected, and then people were always upset that the doctor or the medical association said, well, great, now we have this data, but we don't know exactly what it's like or how accurate it is, and we're supposed to make our diagnosis from it and be responsible for it. I can completely understand that. Yes, so to the same extent that I use telemedicine to collect data from the home environment, I also need, in the same breath, the technology that later helps me as the decision maker to say, this data is good, I can use it, it's meaningful. And the ideal scenario is you don't do anything with the data. You do nothing with the data at all. You've essentially created a patient profile. And if there is a deterioration in the patient's health status, this system essentially wakes me up or notifies the doctor. Now, please take a close look at this. Look, there's a deterioration, there's a trend that might be continuing, or now there's an outlier. Please take a look at this. Look at this data set yourself now. And we urgently need that. And I think they are two sides of the same coin. Collecting data in the home environment, and on the other side of that, I need the algorithms to be able to extract sensible, reliable, and also responsible information from it so that the patient can then be treated. So AI is absolutely essential. Telemedicine is directly linked to it. AI or machine learning is actually what makes telemedicine feasible in the first place.
So if I understood you correctly, perhaps to summarize for our viewers here, it's more or less an alarm system that has already learned quite well when it needs to sound the alarm. Last question for you, Hagen, and that is now the following. What does the future hold for us? You are very involved in contactless measurement technology. And I was also able to see some new techniques at your institute. What can we expect in terms of wearables in the direction of contactless technology?
Yes, well, it's like this. If we put it this way, telemedicine, it also exists for patients who have an implant, like a pacemaker or something else. Data is already being transmitted there. There are wearables, which are things you wear on your wrist or a t-shirt or something else you wear. There's a huge trend in that. And what is, of course, interesting is when you can collect medical data without having to put anything on or attach any device. And we are of the opinion that especially in the home environment, for example, contactless measurement technology like a bathroom mirror, that you can integrate certain things very well there, especially for cardiovascular diseases. So my vision is a bit that medical technology of the future is technology that you no longer perceive as hospital or health technology, but that these are simply sensors, that these are procedures that might be integrated into our bed if we want that, and if it's necessary, that are integrated into our car or into the bathroom mirror, and that it adapts to the current state of health. So I think a lot is happening in terms of measurement technology and contactless measurement technology. That is where you don't have to place any cables or sensors on the body's surface, is of course particularly interesting from a medical standpoint. And that's primarily light, both visible and invisible thermal radiation, and there are radar methods. There's a tremendous amount of activity in that area. That's the measurement technology, so to speak. There are many developments there. On the other hand, there are also many developments with these machine learning methods. I mean, new network topologies are presented every year. And what's interesting there, and one has to say this again, is that these machine learning methods weren't particularly popular in medicine for a specific reason, because they are classification methods. So data went in and a decision came out the other end, right? For example, there's a risk or something is wrong with them. Yes, with the patient. But from a doctor's perspective, it wasn't at all comprehensible why this classification algorithm decided that this patient now has a risk or that there is some kind of deterioration. And this is a new trend where we are also very active, which is called interpretable AI systems. This means that we can essentially see the rules explaining why this result was reached displayed in a comprehensible way. Yes, that's a trend. For example, an ECG is displayed. The patient records an ECG at home and the ECG decides, or rather, based on the ECG analysis, a decision is made. Yes, this is a risk, or he has some kind of ventricular fibrillation or an arrhythmia or whatever it may be, whatever. So, and from a doctor's perspective, it wasn't at all clear how this algorithm arrived at this decision from the signal, and displaying which parameters or which threshold values led to this decision, in my opinion, that hasn't been optimally solved yet. And that's something we're also working on at the Institute, so that we can put this decision-making tool in the hands of our medical colleagues, allowing them to say, okay, we have a very good decision maker here that supports us. I mean, I also want to explicitly state that these are only support systems for medical practice, by no means systems that make the decision themselves. But they also show the doctor that based on these and these values or these and these parameters, the algorithm is of the opinion that a risk or a disease is present. But what's important is that the doctor can comprehend it. That's not yet the case with current systems, and I think that's still missing. And if that is comprehensible, yes, then that's a positive development. It could very well be that the doctor then says, yes, okay, I see that too, but I'm of the opinion that the patient always has this, so I'm deliberately deciding differently. But at least then the doctor is in a position or is practically forced to engage with such an opinion and perhaps to question themselves or discuss it with a second opinion. And I believe that makes the diagnosis more valuable overall.
I think anyone who's interested can also contact your institute and send an email if they have any more questions. Otherwise, I know you're going on vacation with your family tomorrow. I wish you a safe journey and a wonderful vacation in Carinthia. And thank you again for your willingness to do this interview and for the first-hand explanations, which I believe many haven't found in the media so far. So thank you again, Hagen, and yes, have a great vacation.
Thank you very much. Best regards to Upper Bavaria. Yes, bye.
This interesting short presentation has shown you the direction in which these techniques are developing. And it's truly astonishing how, so to speak, you can get information in such a minimalist way if you measure the right signals and, above all, interpret them correctly. And here I'd like to pick up on what Nikki said earlier, which is very important. None of us really know these days what data is being collected and where it's going. Especially with these small, so-called micro sleep labs, the data is usually sent to the cloud, meaning somewhere on the internet, and we have no access at all and don't know exactly what happens with this data. Now, at first, that might not sound very interesting. Everyone will say, my heart rate at night, that's completely irrelevant. But in fact, this is legally protected data, and we are not adequately informed about its further use and what happens to it. Nevertheless, it's a marvel of technology that with such minimalist data and interpretations, and this is the key point, we can, for example, calculate sleep stages, calculate breathing pauses, and much more just from the change in heart rate, which in technical terms we call heart rate variability, and that we can get by with very minimalist signals that more or less partially replace the sleep lab. But please, we must still remember that the data we measure in a sleep lab can be recorded on paper, displayed on a screen, and double-checked. We can intervene and manually, so to speak, change what the device assesses automatically. And we can no longer do any of that with these things that we send to the web, to the cloud, and that are reinterpreted in a kind of black box. This also applies to cell phones with all their functions. It applies to the smartwatch. It applies to this ring that we mentioned. And it's no longer possible for us, so to speak, to somehow verify the final result that is ultimately served to us. Then we simply have to trust. And that only works if this technology is applied correctly and, above all, interpreted correctly.
Yes, and that will be especially important, Rainer, when we get to our last episode of Sleep Lab with Netzer and Popovic, our last episode for now. We hope that we're a hit with you and that you'll keep on streaming. But when it comes to sleep apnea, the most common sleep-related medical condition and the one that affects both of us as pneumologists or lung specialists the most, it's crucial to remember that this data is also sensitive data and that it should, of course, remain with the people themselves. Yes. As I said, the next episode will be about the topic that will probably interest most people the most, sleep apnea. What are today's modern therapy methods? How can you treat sleep apnea? How can you best explain it when you're talking to someone else about it? And we'll take a closer look at that in the next episode. And until then, tune in again. Goodbye, everyone.
And sweet dreams.